Hey guys, so in this video we are going to talk about primary hemostasis. This is great info for step 1 and just a good refresher if you're studying for step 2, 3, or even in internal medicine. So primary hemostasis, again, let's first distinguish the difference between primary and secondary hemostasis. Primary hemostasis is the formation of a platelet plug. And secondary hemostasis has to do with the clotting cascade and formation of insoluble fibrin. Okay, again, this is the clotting cascade, which possesses the intrinsic and extrinsic pathway. So we will talk about this in a later video, really specifically, but keep in mind that when we're talking about primary hemostasis, we will be checking bleeding time as our lab value. And when we're talking about secondary hemostasis, we will talk about PTT as well as PT for checking to see if secondary hemostasis is functioning properly. So let's get right on into primary hemostasis. We said that primary hemostasis is the formation of a, good job, platelet plug. And the lab value that we will check is bleeding time. So the first step in primary hemostasis is going to be endothelial damage. This is such a great test question. I've seen it so many times on so many practice exams. So the first step, again, endothelial damage. And again, the endothelium or endothelial cells are the cells that line the blood vessels. So there will be damage to those cells. And subsequent to that, VWF or von Willebrand factor will be released from that damaged endothelium, and a platelet will come along and express a receptor called GP1B. And the GP1B on the platelet will bind to the VWF. And after that, 4 things will be released: serotonin, calcium, thromboxane A2, and ADP. All of these have a specific function. Serotonin in small quantities will cause vasoconstriction. Calcium will also cause some vasoconstriction. However, it will also attract negatively charged clotting factors from secondary hemostasis. Thromboxane A2 will sequester more platelets. And ADP will kind of do something really interesting, because ADP will come over here and bind to the P2Y12 receptor. And whenever ADP binds to the P2Y12 receptor, that causes the expression and activation of GP2B3A. Whenever GP2B3A is expressed from that platelet, the GP2B3A from this other platelet will bind to the GP2B3A of the other platelet. So we've got these receptors binding together, and then fibrinogen is going to come over here and seal this bond, and we'll put that bond, let's put that in red actually. So fibrinogen is going to come in here and it's going to seal that bond. And remember, fibrinogen will convert into fibrin in the clotting cascade. So fibrinogen will seal that bond. And over again, this happens. And with cooperation from your secondary hemostasis clotting pathway, right here, a stable platelet plug is formed. In our next video, we will talk about the different pathologies associated with primary hemostasis, and then have another video to discuss the drugs and their mechanisms of action. If you like this video or if it was helpful, click like and subscribe. Thanks.